welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we have an important healthcare reminder for folks because you have to be registered for healthcare now. Whether or not you agree with the law, it's the law. So here to tell us all about it is Gaylene Kanoyton, president of Celebrate Healthcare.
Thank you for having me.
This is your mission. You want people to have health insurance. You want people to be healthier and to not, to be able to afford the care that they need.
A healthier society makes a good society. You have to have health care. It's the law. Think about it this way. You have to have auto insurance. You have to have homeowners insurance. So why not have insurance on your body, on your health? So in the long run, down the road, we'll have a healthier society. It'll be a stronger workforce. And it'll be great all the way around. And then people no longer will use the emergency room as their primary physician.
Well, that is, it's a huge driver of this because it drives up healthcare costs for everyone else because people who can't afford preventive care get into crisis situations. And I've read a lot of studies that a huge amount of the cost is people who, get to crisis, then can't afford or don't follow instructions, and then get to crisis again, and what did they call them? Frequent flyers or repeat customers. It's the same people over and over. And it's not good for them either. It's not the way they want to live.
It's not good at all. And let me tell you, in the long run, what happens is with the affordable care, you can now go to your doctor and get a physical, a mammogram, a colonoscopy, and any preventative care services without paying a dime. You don't pay a copay. You don't pay a deductible. So it's no excuse why every year you don't go and get your physical. And if it's something was to happen, it'll be caught early. And it increases your chance for a healthy life and a recovery, and it decreases the cost. It is cheaper to prevent something. Oh, geez, now I'm going to jump into education and early childhood. Yeah, but you're right. But you're exactly right.
Prevention may seem like a luxury, but it's not. It's not. Economic sense.
I can't tell you how many people have been to our Enrollfest and afterwards have come back to me and said, I had never had a mammogram before, and I went for the first time, and I was diagnosed, and I had a small lump, like on my breast, and now I was able to get it taken care of, and now I'm healthy.
So this does allow prevention, but there's a big stick this year that didn't happen the first couple of years.
Correct.
So if I don't have health insurance through my employer or through my parents, I mean, not me, but my kids, what has to happen, and what is the penalty if I don't do it?
Correct. So if you have a child, they can stay on your insurance up to 26 years of age.
And they're doing it too. Covering them.
That's right. And also, if you have a job, it's through your employer, as you said. Now, if you don't have one of those two things, then it's a $695 penalty or 2.3% of your salary, whichever is greater. However, if you don't have a job, or if you've been turned down, or you've been turned down for Medicaid, you have to go and apply. If you don't have a job, you don't make enough money to get a government subsidy, and that's what gives you that huge discount on your plan, then you can go and apply for Medicaid. If you've been turned down for Medicaid, then you can apply for an exemption, and you don't pay a penalty, and that's really important.
But it's complicated. Like you were just sitting here telling me that, and my eyes glazed over. I'm really sorry. But there's so many nuances to this that the unemployed, and not just the unemployed, but the underemployed. Because I think there's a huge army of people out there working part-time, maybe 2 part-time jobs, patching together, a sort of minimum wage kind of living, and they're a little bit stuck.
Well, you look at your students. You have students that work part-time, and then they go to school, so they're trying to have a better life, but they're not eligible for a government subsidy.
Because they don't make enough.
Because they don't make the $11,777 and above to get it.
You have this memorized.
Oh, I have to have it memorized.
But, so this is what is scary about it, is it's hard to understand.
Correct.
It's not necessarily, I'm sorry to say, logical because of the way things have been patched together to get compromises to get the law passed with differences in different states and how they administer things. And so I think people know they need to do something and then they just freeze up. because it's hard to navigate on your own.
And that's the reason why we have these Enrollfests throughout Hampton Roads. And we have this so you can come and get personal help. You can ask questions. We have experts on hand.
So when is the next time that people can come and get that personalized help?
So our next big Enrollfest is going to be January 29th and 30th at the Hampton Roads Convention Center. So January the 29th, it'll be from 2 p.m. to 6 p.m. That's Friday, and on Saturday, January 30th, it'll be from 10 a.m. to 5 p.m. You'll be able to get personal assistance, ask questions. We'll have social services there. We'll have health screenings. We'll have a career, job, and education fair as well. And we'll just have a whole wealth of information, entertainment. We'll have chair massages. But you'll be able to come and just, really just not rush. Just really have things explained to you. Someone will walk you through the plans. They'll get you enrolled. And it's so great because we've seen people pay as low as $5 a month for insurance, $25 a month. A family of 3 I've seen pay $95 a month. But it depends on what your criteria is in terms of your household income is going to be. So you need to bring your driver's license, Social Security. If you have your last W-2 form, bring that. But
maybe last year's pay.
Right, exactly. Pay stub, or bring a pay stub with you.
A pay stub would help.
Yeah, would help too. Bring what you have. They'll work with whatever you have.
And that's one of the other tricky things too, is that a lot of people don't have a defined income. Like, what am I going to make this year? Well, I don't know. How many hours am I going to get? Am I going to pick up a second job? And you have to be able to estimate your income or go based on a previous year's income if you don't have.
That's correct. And then you're able to get you're able to call healthcare.gov, which is 1-800-318-2596, or go on healthcare.gov, and you can always update your profile. And the most important thing is that even after the enrollment period is over with, which is January 31st, that's the drop dead date.
Or you face the penalty.
Or you face the penalty.
Got to remember.
January 31st. Afterwards, if you have a life change, you get married, you have a baby, same way with your employers, you still have special enrollment. So you can still enroll if you have meet a certain criteria.
So maybe people who age out of the 26, or people who lose a job. So maybe they're covered right now. They're not affected by the current deadline, but got a problem coming
and
up.
A lot of times when people lose a job, they still have some kind of a package where they still have income coming in. It might allow them to get a lower pay. And not all employers offer insurance, so therefore you can go into the enrollment program. You can go into it.
Small employers don't sometimes, and so many people are on part-time right now. A lot of employers are nervous about, they've come through the recession, but they're not really increasing their full-time staff.
Well, at the end of the day, it's all about giving back. You have people that complain that, okay, my insurance crept up just a little bit. Well, prior to the Affordable Care, insurance companies were able to raise the insurance hikes $10 to $11. Now it can only go, I think, around $7 or $8. Virginia went up $4. But you have to realize, before the Affordable Care Plan, insurance companies were able to deny pre-existing conditions. So once we opened up the president opened up the Affordable Care, then pre-existing conditions no longer could be denied. So you had a lot of people with illnesses that enrolled into the program. And so therefore,
which is very expensive,
it's very
let's be
expensive
honest.
to do that, right.
And that's part of why we're looking for our 26-year-olds to
we need more healthier people. And we need our young invincibles, is what we call them, young invincibles.
It also is the continuous care. If you are continuously insured, if you're doing the preventative maintenance, if you're catching things earlier, it just makes sense for everybody. Whether or not you agree with the particular law or the particular way we're doing it, it's got to save money if people are getting more regular care than if they're letting a crisis illness build up.
And it's also teaching a culture for a healthy society. Many people put their look at a lot of mothers, they put their health on the back burner for their children. Now they'll be forced, or not forced, but now they'll be able
to have incentives.
To go to the doctor and check themselves out. It's just like, when you're on an airplane, they say give yourself oxygen first first before you give it to a small child.
It's a hard lesson.
That's
isn't
a hard
it?
lesson.
We can't do that as moms.
I know that, but you know, that's what we have to do. We have to think that way. We have to take care of ourselves in order for us to be successful.
And you've talked a little bit about more critical illnesses like a cancer or something like that. But in truth, a lot of the costs are diabetes, weight-related things, things that annual visits or regular visits to a doctor can help keep in check before it becomes an unmanageable situation.
And when you go on a website, I know that you'll see all these plans, and it's like confusing.
It really is.
You can
Gaylene, I've tried to go through that, and it's hard.
Well, you can compare. They have a compare button on there now, and so you can take two plans you might be interested in, and you can hit compare, and it'll put it on a chart for you to compare. That makes it much easier.
And you can't, people heard a lot of scary things about the website when it first launched. There were a lot of problems because so many people were enrolling. That has all calmed down now. They've got better servers.
Correct.
I've been able to get on it, when I've tried. But also, it just helps to talk to somebody. And I will say this, having waded through this once, going to your Enrollfest and talking to someone, even if you know the answers, even if you've done your own research, it's just comforting to have somebody hold your hand through this process.
Yeah, and if you have insurance and still have questions, still come, because coverage to care is important too.
Because you can change coverage, right?
Yes, you can still change coverage. You can still change your coverage. You have up until January 31st to change your coverage. But even if you have insurance and you have questions, coverage to care on how to maintain insurance is just as important as enrolling into it. We want you to keep your insurance. Virginia has enrolled somewhere between 364,000 people to date since November 1st. I think we'll probably go well over 400,000. Maybe I hope we do 500,000. But at the end of the day, it's just all about having a healthier society. And when you come to our Enrollfest, January 29th and 30th at the Hampton Roads Convention Center, you'll be able to get that personal attention along with a wealth of other resources.
That's what I was going to say. In the government, we like to call it wraparound care. But it is the other things that can benefit you. What you can get free at the health department. What can you qualify for social services? People might be shy about asking or might not know how to get that ball rolling. And they'll be right there. And healthy families and, child care, parenting education, important life skills that relate to the health of you and your family.
That's exactly right. And we'll have the city of Hampton will be there with their employment opportunities, and we'll have other municipalities there as well. And we just want to make it a day of fun, a day of education, or 2 days of education, where you can just come and just really learn about this. And you can always go to my website, celebratehealthcare.net, or you can call me at 757-287-0277, and I'll be able to answer questions. I answer my phone all day long. Because I really want to have
for you.
It
is really personal.
It's
isn't
personal
it,
for me.
Gaylene?
It's personal because when I have people come to my events and I see tears in their eyes after they have enrolled because they never had insurance before, it's really heartwarming to see that they now can go to the doctor. It's almost like hitting the lottery. And unless you come and see that and witness that, you may not understand the importance
of having health care. That's my reward. You're involved.
That's exactly right. That's why I'm involved.
Well, thank you. You've been the #1 educator on the ins and outs of this act since it's been established.
Thank you.
And it's been a benefit to the community.
That's right. Thank you for having me.
Thank you, Gaylene.
All right. Thank you.
And thank you for watching. I hope if you fall into this category, or if you have any questions about are you eligible, what can I do, come to Celebrate Healthcare. They will answer your questions. You can go online and do it yourself, or you can, if you're more of an in-person thing, you can do that at Celebrate Healthcare. Thanks for watching.